Hello, everyone, and welcome back. An eye on health right now. Cervical cancer set to impact thousands of women this year. And according to the American Cancer Society, more than 13,000 cases will be diagnosed and more than 4,000 women will die from this cancer this year. Joining us now for this Eye on Health segment, we have Dr. Evan Levy. He's a gynecologist oncologist at Florida Cancer Specialist and Palm Beach Health Network. Dr. Levy, thank you so much for joining us. Let's first talk about the signs. I think that is so important to raise awareness about the signs of cervical cancer.
Oftentimes patients present with abnormal bleeding. They can have bleeding after intercourse, pelvic pain. Unfortunately, with cervical cancer, it often can be a silent disease, and by the time patients present, the disease can be a little bit advanced, and that's one of the reasons it's important to just present to your primary care doctors and present to your OBGYN so that you can get the screening and the surveillance starting from age 21.
I want to focus a little bit, too, on some of the risk factors, but before we get into that, how is cervical cancer detected?
Cervical cancer is detected through pap smears and through pelvic exams. So again, just to harp on this because I think it's super important, it's very important from an early age to get your children to see their primary care doctors, go for yearly visits, and for young women, they should be seeing OBGYNs or primary care doctors, getting pelvic exams, starting to get regular pap smears starting at age 21, and just continuing that on through at least age 65.
What are the risk factors that you want to share about
this? HPV is the cause of most cervical cancers. So cervical cancer is an interesting disease because unlike other cancers, it's actually caused by a virus. So any exposure to that virus is going to put you at risk for cervical cancer. Most patients are able to clear that virus and go on to just live healthy, normal lives. But anything that compromises your immune system, medications that compromise your immune system, diseases that compromise your immune system, smoking, all those will put you at increased risk. And also just, I think the biggest risk is lack of access to care. So going to your doctor is going to help prevent you from getting cervical cancer and really be able to get you cured and healthy.
Yeah. You know, we definitely want to highlight how important it is to get those annual exams and go to the doctor every year. I want to focus a little bit about HPV. And there's so many strains of this virus here.
Yep.
So talk about why a lot of doctors are pushing for the vaccine. Just a little bit about how effective it is, I imagine. So
it's this wonderful situation in the sense that you can prevent somebody from ever getting cancer. And the efficacy is 97%. So women who have never been exposed to HPV and undergo getting the vaccine, and it's either 2 or 3 shots depending on how early you get those first vaccines, go on to never get pre-cancer, never go on to get cancer. So it's highly effective. It is safe, and it's being implemented all around the world, and the data is shocking. The number of cervical cancer rates are dropping. They're plummeting like 60–70%. In countries in Northern Europe and Australia and New Zealand, where they're almost at full vaccination rates, they're seeing that they don't think they're going to have any cervical cancer rates, you know, 20, 30 years down the road. So very important, very effective, and why would you not want your kids to never have a cancer, and all it takes is a vaccine.
Yeah. All right, well, we'll leave it at that. Dr. Levy, thank you so much for joining us and for talking about this important topic, and we'll be right back.
Thank you.